So, I mean, keeping up with all those things, and you mentioned you do have the busy clinical practice. How do you find time for research, and what tips would you give or advice you give to others that, it's too easy to get focused on, one aspect of your job, like the clinical day-to-day duties, or like you say, your editorial duties, but how do you also find time for research?
Actually, I just gave a talk on this yesterday morning. The ACC has a clinical trials research boot camp.
Mm.
I am a co-chair of that, and one of my responsibilities yesterday was to give a talk to that cohort of young investigators about sort of the workings of multi-center clinical trials. And one of the things that I stressed was, if you're going to do research, you really have to interleave clinical research. You have to interleave patient recruitment into your everyday life. You can't, it's just not separate. You don't like, on Wednesday afternoon, I'll do research. If you're a clinical researcher, patient screening and enrollment really has to be kind of integrated into your everyday practice, whether that's in the office, in the clinic, or the imaging lab, or the hospital, wherever the patient is. So finding time for research happens if you like doing research, and you find time. The writing you may do later on at night and on the weekends, but actual clinical research is done, is really fully integrated into our practices, because that's where the patients are.